This is for the love in you. Oh, this is for the love.
Peace and light. This is your self-love advocate, J. Pierre Raven, and this is the Love Right Now show. We're continuing the series, Healing the Black Woman, while I'm sitting down with some amazing women who inspire me by the work they're doing in our communities. And today I'm meeting with Dr. Kim Baker.
Thank you.
Welcome, Sarah.
Thank you for having me. Yes, thank you. I'm so happy to be here.
I'm excited to have you. I've worked with Dr. Baker up front on some projects that she has led successfully and still working on some different things that we're going to jump into. At the beginning of every show, I like to acknowledge a person or a group of people who are self-love slain in these streets, and that is definitely you.
Oh, thank you.
Yes. You just had a baby recently.
Yes, he's 5 months old. Actually, as of yesterday. And
wow.
So, baby boy, CJ.
Congratulations.
Thank you
so
for that.
cute.
Yeah.
And so now you have a little baby and a little toddler.
Yes, a 4-year-old and a 5-month-old.
Wow.
So much fun in that
Yes.
house.
On top of all the amazing things
everything
you're doing in the
else.
community.
Yeah.
So,
here we go.
So
Here we go.
you are tapping into this self-care.
Absolutely trying to. Matter of fact, I'm going to tap you a little bit to try to get some over here.
Got you.
But it is so important on
Yeah.
a daily basis.
Yeah.
Whatever I can to try to take, even if it's just a few minutes for
Yeah.
myself, I try to steal it. So
That's good. That's good. And it's, in a few minutes can go a long way.
Yeah.
So that's
Yeah.
good. That makes my heart smile. I'm happy to hear that. So tell us a little bit about your work.
Sure. So, I'm a faculty researcher at the UT School of Public Health. I've been at UT for almost 10 years now. I actually moved to Houston to get my doctorate here.
Okay.
Fell in love with Houston, fell in love with the work. I specialize in sexual health and reproductive health.
Okay.
And so for years, my work has centered on sex education, sexual health of young people and their parents. But it has really transformed over the past few years from focusing on young people to really all women. And so I love this work. I do trainings. We write curricula. It's just really awesome work.
Wow.
I'm so passionate about it.
What demographics do you work with? Is it everyone, or is there specific demographics maybe on a project?
Yeah, absolutely. And so as in public health, one of the big goals of our work in general is to eliminate health disparities.
Okay.
And we know in the African American community and some other communities of color, there are huge gaping disparities around our health. And with my work particularly, that means our sexual health.
Yeah.
And so whether it's teen pregnancy, whether it's sexually transmitted diseases, whether it's domestic violence, so anything related to relationship and sexual health, unfortunately sometimes some of our communities bear the greatest brunt of the burden. And so a lot of our work does target vulnerable communities, really trying to inspire women and families and grandmothers to have conversations about a lot of things that have been stigmatized in our communities for so long.
Yeah.
And so that's why I find so much pleasure in this work, because not only do I feel like I'm meeting the need of public health, but things that I've seen in my own family and within my friends. And so it's just it holds a dual kind of celebration for me, this work.
I love that. And I've seen you in action.
Oh.
You are very knowledgeable about this and very passionate.
Yeah.
You know, and so
necessary.
let's talk a little bit about the project I was a part of.
Absolutely.
Where you led community leaders, physicians, healthcare providers, because we were looking at, from a research standpoint, why the mortality rate was so high amongst Black women after childbirth. Since you were the first person that introduced me to this. Like, I knew it was high, but I didn't know the huge impact, right? And then it seems like right after your project got started, the conversation just was being had all over the place. And I would like to say that was attributed a lot to you. I mean, we are the fourth largest city, and it got the eyes and ears of a lot of individuals, right?
Yeah,
So how was that project, and what were some of your major takeaways, and what are we doing now?
Thank you, Jay, for that. So the Houston Endowment, one of the largest foundations in our state and in our city, convened some local leaders around women's health care on the response to these stark numbers. Like, why were women dying, and in particular, why were Black women dying as opposed to other women at such high rates? And so, what we found was kind of twofold. We talked to healthcare providers. So we talked to the people who were servicing women and wanted to know what they were doing, what they thought the gaps were, what they felt like they were not doing well. And what we quickly learned is that Texas, at least in our state and in Houston, Harris County, it's not so much an issue of women being pregnant, dying during childbirth or at the hospital. So it's not so much a like, what aren't hospital systems not doing? Because as you know, we have the Texas Medical Center, right? The largest medical center in the world.
Yeah.
But a stone's throw away, you have women dying after they give birth, maybe 40, 50 days after. And so we started to see the problem as there are health issues involved, but there is this lack of support for women once they go home with the baby. And what does that mean for Black women? And so these are questions that we started asking last year that we're still asking. We took a first stab. We had focus groups with women all across Houston. Again, those who provide service, and then women themselves. And what we heard from women, and Black women in particular, was that after they get home with the baby, there's just so much stress. Whether it be financial stress, whether it be relational stress with could be the partner or the father of the baby, or it could be family members. And just feeling like they were not being heard, didn't have the support, or didn't know how to ask for help. So as we started this conversation about self-care, and taking a few minutes, there's so much wrapped into that. And then
it's
there's
like,
so
how
much,
do you do it?
how do you do it? And then there's so much stigma around, if I need help, does that mean I'm not a good mom? Does it mean I shouldn't have done this? Does it mean, like, there's so many contextual situations that happen that the data doesn't speak to, that we're still trying to kind of unwrap and understand. Because the call to action is to, how do we find support for these women? And for a lot of women, although it cuts across class, it does, absolutely so. And so there needs to be a message for every woman in this work. But then there are serious financial resources that we need to figure out how do we get to women during this postpartum period, that they could kind of feel better about themselves and take care of themselves, so they can be here for their child. So I hope I answered your question.
You did.
So we're still working towards kind of the goal. This is like a 20-year lift, to be quite honest, because a lot of that data has been stagnant for so long, and the disparities are so deep. It's just going to take a lot of work and a lot of partnership to move it forward.
Well, I'm grateful for your work.
I'm glad for yours. I'm glad that we were able to connect through this, because there's so many ways that it can grow with the resource that you provide to the community. I just kind of can see how valuable that could be for women who probably have no idea you exist. So how do we
merge
out there more for them? Yes.
I'm just so grateful. I am. And it, whenever I talk about this effort going on with anybody, they're just like, what? Are you serious? Oh my gosh, anything I can do to help? So like, I know once, we start getting the grasp on the root causes of some of these things, that there are going to be some very motivated, energetic individuals that are going to support this. And I think that is just going to be great for our city, our state, our country, our world. So as we're talking about Black women in healthcare spaces, you yourself, and you mentioned this is a cross class. This is not just folks that may not have certain resources as others. This is across the board.
Mm-hmm.
Have you ever experienced anything in a healthcare space where you felt like you weren't being heard?
Oh, absolutely.
Okay. Tell us about one of those times.
So, I guess I'll talk about just an experience here in Houston. And so, throughout my life, I've always had to figure out, well, growing up, I grew up working class. And so, what that meant sometimes is we didn't always have the same doctor. So, there was always an introduction of a new doctor and having to build a relationship. And as a small girl, about how that felt, how intimidated sometimes you could feel around the presence of this new person, whoever, whatever they look like. You know that was the doctor coming in, right? But my mom was very outspoken and kind of modeled that for me, that, you know, you speak up if something's wrong, you know, you ask questions if you don't feel like you're getting the right information. So she modeled that for me. So I was never and felt that I couldn't speak up. But there have been instances where I would go to a doctor here, namely, before I had the wonderful doctor that I have now. But I just felt I always had to question what she would tell me. It was an OBGYN. I didn't have a primary doctor here. I just wanted an OBGYN. I'm like, okay, I'll go there once a year, get what I need, and, you know, get my checkup, and we're good. But I always would feel like she would talk down to me. Very made assumptions about my relationships and if and when and how or who I should be having sex with and shouldn't. And I just really felt that was inappropriate for my provider to say it in the way that she would say it.
Right.
And coming from my background in public health, like I understood some of her questions just for my patient history type of deal. But there are things in the way in which you ask questions and the assumptions you make and things like she would say, now girl, now you know better, or something like that. And I'm like, well, what? I just answered your question.
Right.
What are you talking about?
Right. I need you to be my
provider.
provider.
I need you to be my provider, not my great aunt.
Right.
And so I challenged her one day on those things because I could see, I would sit in the waiting room and I see there were younger sisters in the waiting room going back to see her. And I would just question myself, I wonder what she's saying to them. And this is when I'm doing the work of teen pregnancy prevention. And I wonder if they're walking away feeling shame about kind of either them being pregnant or them deciding to have sex and wanting birth control because there are issues there with some shame that comes. And so I just kind of shared, I said, I just want to share something with you. And I told her how I felt, and I told her kind of what we see in our work, and she, surprisingly, she took it really well. And she said, you know, I'm sorry if I've ever made you felt that way, and please share more materials with me because I really want to know how I can have these conversations with patients without making them feel a certain way. And
well,
so
that's good.
Yeah,
that's
I was
good.
like, well, okay, that worked for her. This is good. I don't know. You know, that's all we can ask for.
That's right. And so you helped her deal with her bias.
Yes, that she didn't even realize she had. And so, and that's a huge thing. You know, all of us have biases.
Yeah, absolutely.
The way the brain works.
Right.
And so, what we are challenged with in public health, and this is kind of with the maternal mortality thing, is how do we get folks who are providing the service to women to understand that and check them and acknowledge them. Sometimes it's hard to acknowledge it because you don't want to say, you feel like you're a bad person if you say you have a bias.
Right.
But it's natural. But we have to acknowledge and check and then move on and always kind of keep them in balance and in check.
And the important thing to note too is bias can come from, if I'm a black woman, bias can come from another black woman who's a provider.
Yeah, this provider was a black woman.
Yeah. So I mean, it's
It does not discriminate in that way.
Right.
Absolutely
right.
not.
And she was probably well intended, but didn't understand the effect. And then I'm really happy that you recognize that her clientele very impressionable and can walk away feeling really loved.
Absolutely.
By being questioned and all
certain
that.
ways.
So that's really good. Thank you for your work.
Thanks.
So who taught you how to take care of yourself as a woman?
Yeah, thank you. it's my mom and my older sister. So my sisters were about 10 years apart.
Okay.
And so I think when I was coming into my womanness, which I would say was early, like my puberty started early, like 9, 8.
Okay.
That was around the time she was going away to college, and I just remember feeling like a sense of like sadness, like no, because I'm like, I got questions, I want to ask you all these things, but you know, my mom has always kind of been like that example of womanness. And then when I got to hold on to my sister, when I got to see her on college breaks, you know, I'm just kind of soaking it all in and asking questions and learning from her. And so that sisterhood with her is very, very, very important to me.
I love that. That's good that you had that support. Anything you wish you would have been taught that perhaps you weren't?
So I guess what I wish I would have been taught. There are a couple of things, and I think it's probably what mainly drove me into the field that I'm in.
Okay.
And so for a long time, I wanted to be the OBGYN. I was going to open up my own clinic. I was going to help teens and communities that didn't have providers. Like I had all these ideas because I felt like that was such a huge gap.
Right.
Nobody talked about sex.
Right. At all.
Nobody talked about it at all. Don't have it. Like
that was the extent. Don't have it. Wait till you get married. Period.
The conversation. Yeah. Boys are dirty. Boys are nasty. Like just that was it.
Right.
And so I've always had questions around these things. I've always been, I guess, very eager and interested in conversations that involve sex or relationships.
Okay.
And so when I had the opportunity to learn more about public health in undergrad, and when I graduated, I started to teach middle school science. When I was trying to figure out what the heck I was doing in my life. Yeah, that was the face. But started sex education in middle school. This was in Vegas. And you know, everything that was confirmed for me growing up, the questions that I had, you know, it's like 15, 20 years later, and these young folks are still having the same questions. Same curiosity, same misinformation. So, so that's what I wish I would have learned more about that no one really touched on. And particularly, this is a really good time to bring this up. I think for the past 3 years, the conversation has evolved on sex education to a conversation around consent. And so specifically on that, I think that is huge. I think continuing to move conversations around consent, especially for our young women and boys.
It's for them too, for sure.
But I say young women, and people don't realize where I'm always going with this, is a lot of times women are told, you know, not to have sex, but boys aren't really told a message. They're told to kind of do whatever you can. If you need tips, come talk to me.
It's like awarded to have sex.
Yes, the message is like just missed on both ends. But I feel so strongly, if you can teach a young woman how to say yes to sex, some people are like, why would you do that? Why would you teach my daughter how to say yes to sex?
Because they're going to say yes anyway.
They're going to say yes anyway. But there have been in my work, there have been so many times when a woman talks about her first sexual experience and the expectation that she had around that had nothing to do with consent. Because she had no idea what that was. Or she had no idea what a yes would look like. And so how can you prepare someone for no or to avoid a situation if they have no idea what a yes looks like?
Girl, you better come on.
So I'm saying, I'm like, it's a culture around that. And so it's like we got to teach our boys not to take and to be respectful and ask and have boundaries and all of that. But we have to teach our women how to say yes to what they want. And that involves sex. So that they know when they don't
say yes.
So
and teach men, you know, boys.
Oh yeah.
God, we teach them how to say yes all the time.
Exactly.
But teach them that no and I don't know is no.
Yeah. No. Silence is no.
Silence is no.
All of it.
If it's not a solid yes, And then I changed my mind. It's no.
It's
too.
no. Yeah.
Right.
Yeah. I changed my mind. Or I wanted it yesterday. Or we had it yesterday, but not today.
Not today.
So also
very
that.
important.
And so I really, if I could reach back, those were things that I wish I would have gotten at a young age.
Yeah.
But that's okay because this conversation continues to evolve, and I'm just glad to be a part of it.
We could do a whole series on
Oh my
consent.
God, yeah.
That's very important. I love that.
Yes.
Thank you for sharing that.
Yeah.
So what advice would you give a woman that was in your situation?
Mm-hmm.
I mean, because you were empowered. You had your mother who was very outspoken, your sister who was able to love on you and give you some advice. What would you say to a young woman or a woman who's in a situation where they feel like their provider is not listening to them or downing them, or they're being affected or impacted by bias?
Yeah, great question, because that is like a scary place to be in. And so I'll just give a quick example if I may. So I just had a baby in May.
Congratulations.
Thank you. But before that, I was put on bed rest 2 months prior to delivery. And so a lot was happening. I wasn't sure. It was scary. Luckily, I had a provider who kind of listened to me when I felt something wasn't right. And quickly got me into the hospital, quickly put me on bed rest, and she did all the right things. But I know that that's not the usual case for some women.
Okay.
And so if I did not have that, I would say having a social support network. So whether it is a mother, a good friend, your partner, sharing how you feel with those people, letting them know kind of your fears, your anxieties around kind of how you feel, your health, because you may need them. If something's not right and you tell your doctor or your practitioner or whoever and they're not listening, that other person can then begin to advocate on your behalf. And that's so important. Because instantly, if you're in a situation, if you're in a hospital already and something's happening to you and you tell someone they're not responding, you just go into fight or flight. You can't, there's nothing else. You can't be like, well, no, I'm going to make you listen to me. Like, you just don't.
Right.
It really is up to whoever that you can have be an advocate for you to say, I don't think you heard her clearly. Let me kind of explain for you. Because then it also relieves some of that stress.
Off of you.
Yeah. And that you don't know what that stress is doing internally, physiologically to your body already.
Yeah.
So, and so for the women and so this is the key gap, because there's so many women who don't have that advocate.
Okay.
At their bedside or at the house when something doesn't feel right or they don't want to bother anyone. And so, like, what can we do as a community to figure out how we get more women those type of advocates?
Yeah, I like that. That's good. Because back in the day, you know, I know with our ancestors, you know, if you had a baby, that fourth trimester, that postpartum period was a big deal. Somebody came over with some food, made sure you were straight, all of that. And we do have to get back to that.
Yes, we have to grab that back.
There's a lot of opportunity there. So what advice would you give, and you actually already gave it, but what advice would you give another provider to help them combat bias?
So we always say listen, but I'll take a step back and just acknowledge that we all have bias. I think that's the hardest part. I think once we realize that bias is just a thing that we all deal with, and we have to acknowledge it. So once we acknowledge it, we know when it's coming up, so we can check it. Like it's just that simple. Because I think there's stigma. You know, folks don't want to be. I didn't say the N word. I'm not a racist. Like folks don't want to be called out.
Right.
But that's not what this is.
Yeah, because it's not about you.
It's not about you.
Yeah.
And so once it's acknowledged, it's easier to check it and confront it.
Perfect.
And just listen to patients. And because providers don't have it easy. They have to make decisions quickly, and so they have to, they're using all the information that they have in front of them. So I would always just say, listen, ask clarifying questions. If you can, have someone else in the room to help the patient. If you need to leave out, that patient can ask that person questions and then come back to you. Because a lot of patients are intimidated to directly ask the doctor, or they don't want the doctor to feel like they're challenging them.
Right.
It's a cultural thing too, in some instances. And so listen, acknowledge your biases, have someone else in the room so people can ask that person questions if they can't ask you questions. So
that's good. Thank you for that.
Yeah.
Thank you for being on the
thank
show.
you. Thank you for having me. Yeah, I enjoyed it. I enjoyed this.
So tell us, there's some cool things going on at UT. Tell us about this project. We really love it.
Yeah, so I am the co-project director of We Can Do More. We Can Do More is about really training health centers, providers, nurse practitioners, better ways of counseling women about their reproductive health decisions.
Love it.
Namely birth control.
Okay.
And so not making sure women have all the options that are in front of them, and that they can choose a birth control method that they like, or if they have one that they don't like, they can switch a method and choose a better method that fits their lifestyle. And so as part of this work, we are launching, it's actually already launched, a campaign. It's called Own Every Piece.
I like that.
And it's really a call to all women of reproductive age to own it. Own your lifestyle, own your experiences.
Yes.
Women are complicated and made of bigger and better stuff, and so birth control is just part of our lives and our journey. And so whether you're a user of it or not a user of it, be knowledgeable about its effects, and if you do want to use it, know your options. And so own everything.
Own every
social
piece.
media space. We have some influencers that are on board that are going to be doing some cool things, and so look out for it. So we're excited about it.
That sounds fantastic. We'll have all of the contact information for Dr. Baker in the description, and how you can be a part of Own Every Piece.
Yes.
Thank you so much
for
joining me and as a part of this series, Healing the Black Woman, and providing some really good content for us and to help us fill these gaps of disparities as it relates to Black women in healthcare spaces. You are on the Love Right Now show. I have been speaking with Dr. Kim Baker. This is J. Pierre Raven, your self-love advocate, and I will see you next time.
This is for the love in you.
I appreciate everything you do.
This is for the love.